long-term care and employer responsibilities. If you did not hear earlier, this webinar is being recorded. Now, may I introduce Spain Green, the Programs and Marketing Manager for the Greater Federal Way Chamber of Commerce. Welcome, Xander.
Thank you, Linda, and good morning, everybody. It is great. I've been scrolling through the site here and seeing all the names, and it's great to see so many people here. Thank you to ESD and DSHS for sharing their time with us, and updating everybody on the Washington Cares Fund. I'm excited about what we have underway here at the Chamber. We've got two big membership meetings coming up. So our Washington State Treasurer, Mike Pelliciotti, he'll be here to talk about our state finances and long-term financial health in July. And then August is State of the Chamber, where our CEO, Becca Martin, will update everybody, not just our members, but the community as well, on what the Chamber has been up to for the last year, how the Chamber is standing now, and the programs that we are looking forward to for the next year. So if you've ever been curious about the Chamber, our August membership meeting is the time to come check us out, network, meet everybody. It'd be great to see some of the faces that I see here on this webinar in person. I will drop a link to our calendar in the chat. And with that, I will hand it back to Linda.
Thank you, Xander. Xander will also be joining the question and answer session after the presentations. Now let me introduce Sebastian Cahe, the Outreach and Language Access Lead with DSHS, to present the Washington Cares Long-Term Care Overview. Welcome, Sebastian.
Thank you. All right, so good morning, everyone. Thank you for being here. My name is Sebastian. As Linda just mentioned, I am the Outreach and Language Access Lead for the WA Cares Fund. And I'm going to talk to you, of course, about the WA Cares Fund, how it works. But before that, I want to start with kind of a brief overview of long-term care, what it is, and sort of painting a landscape of long-term care in our state and what that looks like. So we can go on to the next slide, please. So long-term care is help with activities of daily living, and that can be things like bathing, eating, moving around, and managing medication. But it does not include medical care, so things like doctor's visits and treatment for medical conditions. Long-term care isn't only for older people. A lot of younger people need help, maybe folks with a disability, injury, or severe illness. And a lot of people think that long-term care means living in a nursing home or assisted living, but it does include in-home care as well as many other services like home modifications, home delivered meals, all to help someone age in their home. We know that in-home care can support someone's mental and emotional health in addition to any physical help that they may need. A 2025 study showed that home care significantly reduced symptoms of depression for people receiving care. It improved their quality of life and lowered their risk of loneliness. So with the right support, most people with long-term care needs can keep living independently in their own homes. It's also very common for family caregivers to not realize that they are, in fact, a caregiver. So maybe you go to your mom's house a couple times a week to help cook meals, maybe help her drive her to appointments, make sure she's taking her medications, all of which are common care activities. And the majority of this type of care is provided informally as unpaid care, usually from a family member, could also be a friend or a neighbor. Next slide, please. So a program like WA Cares is needed because the way we've paid for long-term care up until now isn't working. Even though 70% of us will need long-term care at some point in our lives, most of us can't afford it. If we look at the cost there of 20 hours of home care per week, just over $23,000 for 6 months, and we know that other types of long-term care can be even more expensive. But the median household income for Washington seniors is just $69,000 per year. So as we mentioned previously, right, family caregivers are the ones who have to step in to fill that gap. And that can be either with their own savings or by providing unpaid care. And that, of course, has an impact, right, on caregivers. So almost half report a related financial setback and spend an average of 26% of their own income on care-related expenses. So a public insurance program like WellCares gives workers a more affordable way to pay for their long-term care needs by allowing them to contribute while they're working and their income is higher. And then they can access money to pay for the care that they need later in life when they're on a fixed income. Covering all workers also helps keep contributions low, and once someone retires, those contributions stop. This approach to paying for long-term care is also more affordable than private insurance at the time when people access care. And unlike private insurance, which typically requires someone to pay out of pocket for 90 days before they can access benefits, WellCares has no deductible or waiting period. Next slide, please. And the reality is that paying for long-term care is a problem faced not just by lower income families. Really, most of us don't have enough retirement income and savings to live comfortably, and much less to cover those high costs of long-term care. And even if someone has some retirement savings, very few have enough to get by. As we can see in the chart there, 41% of Washington workers near retirement have no projected retirement income from a pension, a 401k, or IRA. And then another 42 have no pension and only enough 401k or IRA savings to replace less than 10% of their pre-retirement income. So that means that over 80% of us don't have enough savings to pay out of pocket for the care that we may need as we age. Next slide, please. So getting into the WellCares Fund and how it works. To earn WellCares benefits, most Washington workers automatically contribute 0.58% of their paycheck during their working years. And you only contribute while you're working. So again, if you retire or if you become unemployed, those contributions stop. Everyone's covered at the same low rate regardless of pre-existing conditions. And as of May 18th, folks can apply for benefits. They'll need to meet a contribution requirement as well as a care needs requirement, which we'll talk about here shortly. And once approved, you can choose how you want to use your benefit. So the full benefit amount starts currently at $36,500. And I say currently because it will go up with inflation each year starting January of next year. And you can use your benefits for any covered services and supports that you want. There are no out-of-pocket costs when you need care, and we pay the providers directly for the services that you receive with no copay or deductible. Next slide, please. So just to get a sense of what those contributions look like over the course of someone's career, if we focus in on the middle column there, a typical worker participating in WellCares earns about $59,000 a year. So they pay $29 in contributions per month, which adds up to just over $10,000 over a 30-year career. So to earn less in benefits than someone contributes, they would have to make an average of $210,000 each year for 30 years. Next slide, please. So everyone who is contributing to the WellCares Fund more than 500 hours per calendar year is earning benefits, and that includes part-time and temporary workers. So to qualify for benefits, someone has to meet the contribution requirement through one of these three pathways. So first on the left there, we have the permanent pathway, which will earn someone lifetime access to the full benefit amount by contributing for at least 10 years, and this is at any point in their career. Then we have the temporary pathway, which will earn someone access to the full benefit amount if they've contributed for at least 3 of the last 6 years at the time that they apply for benefits. This pathway is designed for people who have contributed recently at the point when they need care, but maybe haven't earned permanent access yet. And excuse me, in 2026, applicants who contributed for 3 years at any point in the program can qualify right through this pathway. And then we have the transition pathway, which will earn someone permanent access to 10% of the full benefit amount for each year that they contribute. This pathway is specifically for folks who are born before 1968. So as an example, if someone has contributed for 2 years, they'd earn 20% of the benefit amount, which is about $7,300. So this pathway is designed for people near retirement when the program launches, and therefore may not be able to earn, again, permanent access to the full amount. But these workers can also earn the full benefit amount if they qualify through another pathway. So someone, as an example, someone retires and maybe continues working part-time, they could continue contributing, right? They would continue contributing and earn access through, again, one of the other pathways. And then we have the, excuse me, next slide. I was jumping along. The care needs requirement. So to use your benefit, we'll determine that someone needs help with 3 or more activities of daily living and will also continue to need help for at least 90 days. So those activities that we consider are the ones that you see on the screen there: bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. And we'll count any activities that someone needs supervision to complete, right? So it's not just physical limitations, but also supervision is a part of that. So someone who is monitoring, right, the person needing assistance, maybe reminding them, maybe to take their medications, to start or keep going on an activity, or help setting up, all of those would count. Next slide, please. And so when someone's ready to apply for benefits, they'll start by creating an online account. If someone needs help managing their account, they can set up an authorized user, which could be a loved one or a representative if they already have one. You can also get help from the local area agency on aging. They have dedicated staff that can assist in person. And we also, someone can call over the phone. We have our customer care team that is also able to assist in with language interpretation services provided as needed as well. And then once someone submits their application, we'll confirm they've met that contribution requirement. After that, they'll be able to schedule an appointment to talk about their care needs. And after we've met with them, we'll let them know if they're approved to start using their benefits. Next slide, please. So once someone is approved, they can use their benefits for any covered services and supports from a Walk Cares provider. So of course that will depend on the person needing care, their needs, their preferences. But someone may want to choose services to help them stay in their own home. So things like in-home care, home modifications, home delivered meals, or adaptive equipment and technology are all covered. We also cover many services that support family caregivers. So someone can get paid care from a loved one, including their spouse, or they can get respite care so that that caregiver can take a break. We cover education and consultation to help manage someone's care, dementia and behavioral supports, as well as care transition coordination to support someone when they leave a facility like a hospital. Someone can also choose to receive services in their community, so things like an adult family home or adult day services, or someone can choose to receive care in an assisted living facility or nursing home, and that includes memory care. Next slide, please. So just to get a sense of really how far that benefit will go, we know that for about a third of people, or that about a third of people need care for a year or less. So for those people, again, depending on the services that they choose, Walk Cares may be able to cover all or most of the care that they need. For others, Walk Cares will be able to provide the family with immediate relief, but also time to be able to plan for some of those future costs that they may have. So again, these are some examples of how someone could use their benefit. If someone, let's say, would like to pay a family member for care, They can receive care for 10 hours per week for 2 years and also get care supplies for under $35,000. If maybe they want to make their home more accessible to keep living there independently, they can make home modifications, install a personal emergency response system, and get meals delivered for 3 years for just over $36,000. Or maybe someone needs more short-term help after an accident. They could get in-home care for 20 hours per week for 6 months, install a ramp, and buy safety equipment for less than $29,000. Next slide, please. So Walk Cares provides a modest benefit for a modest premium. So someone might want additional coverage in case they need care for longer or maybe choose a more expensive facility. So the legislature has created standards for supplemental private insurance policies that are designed to work alongside the Walk Cares benefit. So it's similar to how Medicare works. The public insurance provides a foundation of financial security for everyone, and then private options are available for those who want more coverage. These supplemental private policies will kick in seamlessly once someone has used their Walk Cares benefit, and the supplemental market will give consumers options for coverage amounts and prices, but policies should be more affordable than current private insurance policies since Walk Cares will cover the deductible. And in terms of timeline, the Office of the Insurance Commissioner is completing rulemaking, and then the policies will become available as early as 2027, so next year. Next slide, please. And then starting in July, so next month, someone can choose to continue participating in Walk Cares if they leave the state. So to become an out-of-state participant, you have to have contributed for at least 3 years, working at least 500 hours or more per year, and then you must opt in within a year of leaving Washington. So just like other workers, out-of-state participants will keep contributing to the fund during their working years, and those benefits will become available starting July of 2030 for out-of-state participants to access those benefits. And next slide. So I did want to share just a few, I guess several key dates as we approach program launch in less than a couple weeks here. So in January of this year, we began a pilot program in a few counties to really test our processes. That was concluded as of end of March for applications. But as of April 1st, workers and recent retirees who have contributed can create an online account to check their annual contribution statements. That account will also be where someone can eventually apply for benefits. And as of May 18th, applications for benefits have opened statewide. And then July 1st, as I mentioned, right, is when all beneficiaries can start receiving services. So with that, I will hand it over to Todd from ESD.
Okay. Good morning, everybody. Thank you, Sebastian. Great work. And thank you to the business community for joining us this morning. I hope this hour is the highlight of your day. My name is Todd Dixon, and I am the Employment Security Department Outreach Manager. And our agency provides insurance services, employer services, labor market information, shared work, and WorkSource services to the Washington State community. I'm going to share with you a quick overview of employer responsibilities for Walk Cares. It also includes a few bullets regarding the two other insurance programs, which include unemployment insurance and paid leave. I have a few subject matter experts with me this morning to help guide me and to answer any questions at the end. They might also jump in to help provide clarification. Your chamber has been so supportive in getting us all together, working with my colleague Cheryl Brown and her team to make this all happen. All right, Colin, let's get started. Next slide. So employers have responsibilities under Walk Cares. They don't contribute to the fund, but we require employers to maintain record of exempt employees that we'll talk about here, collect the premiums, and report employee hours and wages on a quarterly basis. We provide definitions of employer, which is consistent with paid leave, and we also define wages and have some information about the Social Security tax, which in WellCares does not apply. Next slide. So there are some opportunities for employees to be exempt from the program. Employees apply through ESD for the following exemptions: veterans with a 70% or greater service connected disability, spouses and registered domestic partners of active duty service members, out-of-state residents, and active duty service members with off-duty civilian employment. Non-immigrant visa holders are automatically exempt unless they tell their employers in writing that they want to participate. There was a private insurance exemption which has passed. Those were folks who had private long-term insurance policies before November 1st of 2021. We received those exemption requests, and those who received that exemption are still permanently exempt. However, from January through June, people may rescind this exemption. So it was permanent, but starting from January 1, 2026, for a year and a half or so, people may rescind this exemption. Next slide. There was some recent legislations adding that beginning July 1 of this year, employees who move out of Washington may continue in the program by opting in. If they opt in, they cannot withdraw from coverage and are responsible for reporting their own out-of-state wages. There's some language around eligible beneficiary to reside in Washington or as out-of-state coverage. We removed some language that did not allow a break of service for 5 or more consecutive years for the full access pathway. Added the exemption opportunities for active duty members that we just talked about. And we provided some updated language around limitations of certain exemptions. All this information can be found on our employer web pages at esd.wa.gov. Everything that we're talking about here can be found on the employer page of our website. Next slide. There was other legislation that individuals who were exempt from long-term care insurance, now they may rescind that, rescind it. And they have until July 1, 2028. So 3 or 4 years ago, there was a period where folks who had private long-term care insurance could get exempt. Those exemptions were granted. There's some record-keeping requirements. Now there's an opportunity for those that are saying, okay, I was exempt, I'd like back in. And as you can see, we were provided some authority to conduct a benefits pilot, which Sebastian shared was completed successfully. And the website, Rhonda, is esd.wa.gov, and go to the employer section. Next slide. So we ask employers to manage exemptions. The employee has a responsibility to apply, and if approved, however, to provide a copy of their approval letter to the current employer and future employer. Once notified of an employee's approved exemption, employers must keep a copy of that approval letter on file and not deduct WellCare's premiums from these exempt workers, and be sure to mark them exempt on quarterly reports. Employees are not entitled to a refund of premiums withheld before their approved exemption. Next slide. There is some reporting and premium collection requirements as an employer, and I'll go over those. Every quarter, all employers must complete and file a report with employee hours and paid leave wages and pay the premiums. There's one report due for both programs. You must file even if you do not have payroll. Here's what you should report. Basic details about your business, the wages, hours, and again, for For walk cares, and if employees provided you with an exemption approval letter, make sure they are marked exempt on your quarterly report while that exemption is still active. Next slide. And these reports are due the month following each quarter. Next slide. So we didn't talk about paid leave. There are some recorded webinars that the Chamber and ESD hosted on this last month. But the paid leave premium, that's the paid family medical leave program we'll talk a little bit about here. So that premium rate is 1.13% of gross wages. The employer share is about 1/4 and the employee is about 3/4. However, small employers, and that's employers who have less than 50 employees, do not pay the employer share. So the premium is simply collected on behalf of the employee. There is a Social Security cap for the paid leave premium of $184,500. Again, not walk cares, but paid leave is for your employees to take paid leave through the state when they have a significant health qualifying issue or to take care of a family member with a significant health qualifying event. Regarding the walk cares premium, the premium is 0.58% of an employee's gross wages. There is no employer share, so you're just collecting on behalf of the premium. However, some employers may choose to cover the premiums as an added benefit, and there's no Social Security cap for walk cares. Next slide. So I'd like to share with you a little bit about employer accounts, either with you or your agent or bookkeeper that's maintaining this. Next slide. So most of you probably already have an account. You register your business, enter your UBI, and I'm going to talk here a little bit about, we always encourage full access to accounts. You do that by setting up a PIN, and we do that through the mail to create data security. Next slide. So employers have different access levels at esd.wa.gov and through the SAW account. So with limited access, there's no PIN verification. You can submit reports, pay your premiums, and request a change of address. However, if you go through the PIN verification process, you can amend past reports, view transaction history, premium calculation breakdown, apply for small business grants through the paid leave, view voluntary plan and conditional waivers, and view limited employee benefit information. Some of that's on the paid family leave, but access levels, with full access, you have more information regarding employee and premium collection. Next slide. So to get full access, you request a PIN letter to be sent to the address listed on the employer record. You'll receive a PIN in 7 to 10 days. And then we walk you through the process of getting full access to your account. Next slide. Here's a quick look at the employer portal homepage. There has been some updates, some quick action buttons up top, an account alert banner notifying you of certain things. And there are tabs at the top contain drop downs for easy navigation so that you can have more control over your account through ESD. Next slide. So there are some employers that have agents or powers of attorney that work on their behalf. And what I would share with you when you look at these slides is There's some benefit guides at the bottom, hyperlinked here, also at our website. So paid leave and walk care guides for POAs and agents, very detailed information. Next slide. We have some resources available to you to help guide you through unemployment insurance, the Washington paid family leave, and walk care. So you can email us at any time at thepaidleave.wa.gov. Just include your UBI or business in the subject line so that employers get routed correctly. Our 833 number, thepaidleave.wa.gov, the walkcaresfund.wa.gov. If you one of the big takeaways I would share with you is that esd.wa.gov on the employer section will get you to paid leave, walk cares, unemployment insurance information, and also link you to Sebastian's resources as well on the benefit side. And then you can get regular updates by signing up for our monthly employer newsletter, where you get regular updates, and it's we're getting good customer satisfaction and open rate responses from our employer newsletter that provides you continued update information on our insurance programs. I think there might be one more slide or a couple slides. We have several toolkits and guides at esd.wa.gov on how to report wages and collect premiums. There are self-employed electric coverage. So if you are self-employed and meet that criteria and you don't have employees, you can opt in to these programs and pay the premium as if you were an employee, report a certain number of hours, and receive the benefits of these programs. So I encourage you to look at self-employed election coverage for those of you who are self-employed and don't yet have employees but want to take advantage of these programs. The volunteer plan guide is for our paid leave program. If you'd like to set up your own paid family medical leave program, we walk employers through the process. It's fairly simple. The paid leave program must meet the minimal threshold of the states, but can be greater benefits. But again, that's not for walk cares. This is for the paid leave program. These are both newer programs, and so we get a lot of questions about them. And I think, Colin, that might be, I'm trying to remember the next slide, or are we at the end for Q&A?
I believe that we are at the end. I'm sorry, I forgot to add a question slide to that. So
great.
But yep.
And then I don't know if Linda's guiding that or Xander or how we'd like to walk through these.
Thank you, Todd and Sebastian, for your guys' presentations. They're very informative. Now let's open it up for question and answer sessions. There have been a couple of questions there in the chat. Let's start with sharing this with your HR or access to the slides after this presentation. The PowerPoint will be sent out to participants in this presentation. So watch your email for that. And Colin has also provided several links to the link page that was displayed previously, and also links to those monthly newsletters. Let's start with, there was a question in here. Does the exemption start immediately upon receipt of the letter or at the beginning of the next quarter? And there was an answer for that. Once approved, exemption takes effect at the beginning of the following quarter, and it will be mentioned in the approval exemption decision letter.
Can I add real quick? Sorry, this is Jeanette.
Absolutely. Hi, Jeanette.
Hi, I just wanted to just expand on this a little bit. Exemptions are is in the chat. Exemptions take effect at the beginning of the following quarter. If, however, you have a new hire who is currently exempt and their effective date is before their hire date, from the date of hire on, as long as they provide that exemption letter, you would not be taking out low-risk premiums. I hope that makes sense and clarified that just a little bit. If you hire someone in the middle of a quarter and they're already exempt from the time that you hire them, premiums would not be assessed.
There is also a question that if you had private insurance and decide to opt out, um, do you still have to have the Washington long-term care somehow? And Janet, you had said that there was no requirement to maintain that private insurance. And do you want to expand on that one at all?
Yes, I'm sorry. Is my audio okay?
It's a little better now than your first response, but let's give it a try, Jeanette.
Okay, I am just a little
Oh, it
closer.
is better. Good now.
Okay, good. Just a little closer to the microphone now. So the private long-term care exemption in the law is a permanent exemption. And as Todd mentioned earlier, it was only available to apply for a certain time frame and for individuals who had purchased private long-term care insurance before, I think it was November 1st of 2021. So the way the law is written is that exemption is permanent. There are a number of reasons why private insurance carriers cancel insurance, and it's potentially for non-payment. That's all handled by the private insurance companies, and we don't have authority over that. There's also no requirement that was written into the law that people maintain their private insurance, private long-term care insurance, or that we monitor that. That has, in saying that, it has been a consideration of the Long-Term Services and Supports Trust Commission to require that, require verification every few years, but that did not get included in recommendations in any of the commission reports that they report to the legislature annually, nor has the law been changed to require that people maintain that long-term care coverage. So there were quite a few people who really wanted to elect coverage and opt back into the program because their private long-term insurance had been canceled or they didn't maintain it. And that is part of the reason that the legislature opened up that time period to where people can opt back into the program. And unfortunately, the people who do have the private long-term care insurance and don't opt back in, they won't have long-term care coverage. So you are correct, Karen, in your last clarification question, that people who did receive the long-term care insurance exemption and did not maintain their coverage, nor do they opt back into the program, are basically choosing not to have long-term care insurance. That being said, the Office of the Insurance Commissioner has also developed supplemental insurance policies that some private long-term care insurers are looking at and are also offering to supplement the WellCares Fund program. So I hope that answers your question and clarifies that a little bit. It's just a little, it really is something that people are choosing to do and have chosen to do once they did get the private long-term care exemption. If they do not maintain that coverage, they are choosing to not have long-term care coverage.
That was very helpful. Linda, I see one question in here on counting for 50 employees, which is part of the paid leave program. I know that our agency is getting ready to provide employer education on how the 50 employee count is calculated. Hemodine or Jeanette, do you have any general guidance for that now, or should we wait until we send out employer information and update the website?
Yeah, good morning. Thank you, sir. Ms. Susan, are you referring to like should the employer include part-time employees in their quarterly report? Is that what it's being referred to if they have less than 50 employees? Can you add clarification? I'm not sure what that question is being referred to.
It could be also how we calculate employer size, or how they contribute, and possibly with protection under the paid leave program.
But the employer will report all employees, whether they're working full-time or part-time, in the quarterly reports. As for the job protection, as long as the employee has been working for that employer for 180 days, they will have job protection.
Yeah, and the guidance on whether an employer meets that 50 employee count for their extra obligations. Does it include part-time workers, or how did this employer sizing project we're working on, how is that calculated regarding the employer portion? And Brett's providing the WAC, which will be very helpful. Linda, you want to read this next question here?
So if people have private long-term care insurance, they are no longer allowed to apply for an exception and will be required to participate in the state plan. And Jeanette responded that that's correct. The exemption was only available for individuals to apply through December 31st, 2022. The next question was, what if a new hire fails to show exemption letter until approximately 90 days after the hire date? Can the employee get a refund of the Washington Cares contributions? If not, does the employee have to wait until the first day of the next quarter for the exemption to kick in?
So Jeanette, Brett, or Hemodine, would you like to respond to that?
We have a WAC that addresses that about an exempted employee. I'll drop it into the chat, but it says if an exempt employee fails to notify an employer of their exemption, the exempt employee is not entitled to a refund of any premium deductions made before notification was provided. And I'll drop that into the chat here.
Thank you. Go ahead, Linda. Are you seeing any other questions?
Lynn Robbins entered in the chat, and the second part of the above question, I believe that's referring to, if not, does the employee have to wait until the first day of the next quarter for the exemption to kick in? So if they were late providing that exemption letter, would it be the next quarter they don't get the refund, but then the next quarter the exemption would be starting for them?
Jeanette,
the
do
new
we
employer.
address that in WAC? I'm going to lean on Jeanette a little bit here.
We didn't actually address that in WAC, but if someone gives you the exemption letter mid-quarter, it's not really addressed in that's actually a really good question, and it's a little bit confusing. And I think a lot of that is up to the employer. So when you go to report, you're going to either be marking that person as exempt or not exempt. And the employer has the option at that point to refund for, anything that could potentially have been taken out before the reports are made to ESD, or have it be effective the next quarter because you've already taken out the premium. So that's, I mean, that's not something that's addressed in WAC, and that's a really good question. So we have not provided a lot of guidance on that, and because pay dates and payroll are so different from employer to employer, and if an employee is exempt and so real life scenario here, you're going to do your report, and if you have marked the employee exempt and you have already collected premium and they gave you the letter in the middle of the quarter, the employee is actually not entitled to a refund of those premiums, and they stay with the employer. As an employer, you could refund those premiums, but you're not required to, because the responsibility to provide the exemption letter is on the employee.
Lynn, did that answer your question?
And Keeman might have something to add here. I see his hand up.
Yeah, I was going to, if there was no additional questions regarding that question, I want to go back to what Ms. Suzanne had asked. There is a 50 employee count before employer premium obligation. So the system will calculate employer obligation to pay employer portion of the premiums based on the reported quarters. However, in order to reflect the recent changes in the law, there will be some updates in the system that will allow the employers to enter the end of quarter employee count information starting with Q1 of 2026. So if you have some employees who are there temporarily basis and you want to be able to submit that actual employers that work for you, you will have the ability to log into your account and be able to select the end of quarter employee count information and enter that information for the system to calculate your sizing correctly. Hopefully that helps as well, Ms. Susan.
Our next question was, can an employee decide to have the employer stop making the long-term care deduction from their paycheck if they didn't or don't show having private insurance? This would be because they no longer want long-term care but don't have private insurance.
The answer to that is no. They have to have applied for long-term care insurance exemption and have had that granted in order to not have premiums assessed.
The next question is, would Washington Cares be okay with an employer refund even though the WAC says the employee is not entitled to it?
Yeah, they're not entitled to it, but we wouldn't have anything to say one way or the other. If the employer decides to refund those premiums, they're entitled to be able to do that. We wouldn't have a say one way or the other. If they want to just give the money back to the employee on their, it's not required, but it doesn't mean that they can't.
Are there any other questions about the long-term care or about the employer responsibilities? There's a question, how do we go about rescinding an exemption?
So, individuals who would like to rescind their exemption from long-term care insurance, the long-term care insurance exemption, there is a spot to do that in your account. So you would have to log into your sorry about my audio. Let me see if I can fix this again.
Is this better?
Yes, thank you.
Okay. I don't know what's going on with my Zoom audio. It seems to always mess up like this, so I apologize for that. So there individuals who wish to rescind their private long-term care exemption have to go into their SAW account, and there is an area in there that walks you through how to do that. Individuals have to do that on their own, so it's up to the individual who wishes to rescind their private long-term care insurance exemption. It's up to them to go into their account and do that. And then there is also a verification letter that that states that individuals have rescinded their private long-term care insurance exemption. And that should be available to print out. Am I right about that? Kimudin, do you know?
Yes, ma'am. So the employee has to log into their SOA account, and once they're there, there will be the functionality available for them to request rescinding their exemption. Yep.
Do we have any other questions for either the presenters or Xander with the chamber information? Please feel free to post a question in the chat or take yourself off of mute and ask. Here's a question. Where can I find more information on coverage for self-employed, and what kind of reporting would be required?
I can share a link to our self-employed page on our website that really, I think, is the best way to read through that more detailed information. So I'll put that in the chat.
Yeah, that's great. And then at esd.wa.gov, under the employer section, there's a section on self-employed and a really good guide as well. All right, Linda, it looks like we're wrapping everything up, I think.
Yes, this has been a very informative presentation. Thank you again to Sebastian and Todd and Xander for their presentations. And before we leave, Xander, do you have one thing you would like our audience to take away from the presentation today?
Yes, I do. I'd like to encourage everybody here today to sign up for the monthly employer newsletter from ESD and the Washington Cares Fund newsletter from DSHS. Todd and Sebastian put links to each of those in the chat, but I'll paste them again now so you don't have to scroll up to find them. But I definitely recommend signing up for both newsletters to get regular updates, resources, and most importantly, they will give you the up-to-date information so that you know you're always up to code. Thank you again to all our presenters, and Linda, thank you for facilitating. Back to you.
All right. Todd and Sebastian, what would you like our audience to take away from today's presentation also?
These are newer programs. There's lots of benefits, lots of questions. We are doing a good job of keeping our website up to date, and employers have access to phone numbers and emails, and we have pretty good customer support to get back to you. So please visit our website and reach out to Xander or ESD if you'd like other presentations on this topic.
And from the Walk Care side, I think one thing is sharing, this is a topic that may impact us on a personal level. So in addition to professional level, so if we know folks, family members, neighbors, people in our community that may be, needing long-term care, then obviously this is a good resource to share in addition to professionally. So definitely appreciate any sharing. And again, our website is really the best way to look at the latest information and sort of review how the program works and specific pathways. So encourage folks to review the website as needed. We also have monthly webinars that folks can register for to also learn more. So those are all good ways to stay up to date.
All right. Thank you again to our presenters, Xander, Sebastian, and Todd. The recording will be available in the link in about a week. And then the Washington Cares presentation will also be sent to all attendees with those active links on that last page. So that way you can access those. Thank you again and have a great day.
Thanks, everybody.